morning. It's around 9 o'clock right now and I'm heading to school. I only have 2 classes today. I have my med-surg lecture and I also have pathopharmacology 1. There's not a ton going on this week besides the fact that I do start clinicals on Wednesday. I'm honestly a little bit nervous about it because I'm going to be on a med-surg unit, and obviously, as you guys know, my last clinical rotation that I had was for nursing fundamentals, so I was in a nursing home, which I was already comfortable with because I've been a nurse assistant for 2 years, and that's the setting I primarily worked in. So this will be my first time in a hospital, well, working in a hospital, not my first time ever in a hospital. I've been to this specific hospital that I'm going to so many times, whether it be for myself or family members, so I kind of already know my way around it pretty well. I would say the one thing that I'm most nervous about is I've heard lots of horror stories of doctors being really rude and disrespectful to nurses and nursing students, and I'm really sensitive. I feel like if a doctor ever said anything mean to me, I'd probably cry, and I don't want to cry at clinicals. I've yet to cry at clinicals, knock on wood, and I don't want to cry anytime soon. I do have to study because my first exam for med-surg is next Monday, so I have a week to study for it. So I'm probably going to start studying tonight, but other than that, I really don't have a lot to do this week. Luckily, the med-surg instructors and the pathopharm instructors decided to coordinate when their exams would be, so at least for the first couple months of school, none of the exams fall within the same week, but I think the last month, either the last month or the last couple exams do fall either on the same week or the same day, but I have a while before I need to even stress out about that, so that's good. I've definitely been stressing out a little bit about how my time management and study habits are going to go having 2 nursing classes now, because last semester I only had fundamentals, lecture, lab, and clinical, and that was pretty much all I had to worry about besides like a couple religion classes that I had to take. Also, just so you guys know, I did start school last week, but I didn't start till Thursday, and then I didn't have any classes on Friday, so I decided to just start this week when things actually picked up a little bit. I feel like I'm rambling on, and I don't want to ramble on too much more. I want to drive the rest of the way to school safely, so I'll catch back with you guys later. I'm now driving home for med-surg lecture. It's just kind of boring because we're just talking about, like, you know, the basics, the introduction. We're not really getting into some of the more advanced and obviously more interesting stuff, so I felt like class was just dragging on. Same with pathopharmacology today. It was dragging on so bad, and that's a shorter class than my med-surg lecture is, so that was honestly surprising to me, but it dragged on. It felt like the same length, honestly. Also, just to re-clarify, I found out that I screwed up in my mental math earlier, and I actually have 2 exams next week. So I have my med-surg exam on Monday and I have my pathopharmacology exam on Thursday. So they do fall in the same week, but at least they're not on the same day. Okay, I apologize for the not so great lighting. I didn't feel like bringing out my ring light right now. I'm feeling a little bit lazy, and it's also kind of a hassle to get my ring light out from where it is and then bring it into my room and then plug it in and then set my phone up on it. I just didn't feel like doing that. So just bear with the bad lighting for the time being. I just wanted to quickly show what I'm using as a school bag for this semester. So this is my school bag that I'm using. I actually got this on Temu. It was like $8 or $9. I know they have it on TikTok Shop too, and it's around the same price. It's literally the exact same bag, and it fits everything. Not only does it fit everything, but it looks cute with any outfit. Like, I could literally show up to school in this, and it still looks good. So it has my MacBook, 3 notebooks, a planner. Let me talk about the Band-Aids really quick. Okay, it's like 2 in the morning, and I'm editing right now. I was supposed to be showing what was in my clinical bag, but I was in such a weird mood and I could not form a single sentence, so I cut the entire thing out, but I wanted to leave in the story time of me talking about why I have Band-Aids in my clinical bag just trust the process. It's actually really funny, and I'm sure I'm not the only one that's gone through this experience. If you're not already in nursing school and you're watching this, you're probably wondering, you're gonna be at a hospital full of band-aids, why do you need a band-aid on you? I have band-aids in my school bag as well for this exact reason. I will never not have band-aids on me anymore while I'm in nursing school. I was in lab last semester getting signed off on medication administration. So with that obviously comes oral medications, whether that be pills or liquid meds. We also did injections. So we had to do intramuscular injections, subcutaneous injections, and intradermal injections. So while I was getting signed off, I had already done all of the oral medications. I was good with that. I had already done my sub-Q injections. That was all good. Before I get into the rest of this, I just want to say that my instructors did a terrible job explaining needle safety and the proper way to uncap a needle. I was about to do my intramuscular injection, and you're supposed, first of all, just for anybody who is about to go into nursing school or who is about to maybe learn how to do injections, when you're uncapping a needle, pull it outwards and far, okay? Put the cap in this hand, put the syringe that has the needle in it in this hand, and pull it outwards, away from each other. They didn't teach us that until after the incident. I pulled this way. I pulled up. And if you don't know, the caps of needles are, for the most part, on there really good. So you do need to pull pretty hard. Keep in mind, this was only like my 5th time ever doing this, because when we learned how to do this skill in class, we did it once, we didn't have any time to practice, and then 3 weeks later is when we were getting signed off on it. I went to go pull the cap off this way, and when I did, because of the tightness that the cap was on, my hand rebounded, and I stuck one of my fingers with the needle. Keep in mind, I'm getting signed off on a skill right now, so it's not exactly the time to cause a scene. And this wasn't a normal sign-off where, you know, you're one-on-one with your instructor. This was a whole class sign-off because it was a skill that we had 3 instructors in that lab. So they were able to spread out around the room and just like check people off, make sure they were doing it right, keep an eye on things. I was thinking to myself after I stuck myself that it wasn't gonna bleed a lot, because I mean, I've gotten my finger pricked at the doctor's before, and anytime that I had, my finger barely bled. They had to squeeze it so hard to get any blood out. When I tell you that there was blood all over my hand, I'm not exaggerating. It was everywhere within seconds. And I was trying to hide the fact that I stuck myself because I was really embarrassed and I didn't want other kids in my class to see, because I thought it was like such a bad thing. I was like, oh my gosh, what are they gonna think of me? I just stuck myself with a needle. So I was trying to hide it. So I like had my hand like in between my legs, and there's blood all over my scrub pants now. I eventually just had to tell my instructor that I stuck myself because there was too much for me to clean up. I needed to wash my hands. I was trying to use little alcohol wipes, but it wasn't soaking anything up, so it was not really working. And my instructor literally told me I had to wait to do the rest of my skills before I could wash my hands. I did have to get re-signed off on the skill, and I did, because obviously I made it to the next semester. One of the instructors made me feel a lot better about it though. She said, everybody's gonna do it at least once, and it's better that it happened in lab anyway, because you're not contaminating yourself or any other people. So it's, you know, it's just practice, it's just a simulation. So if it's gonna happen anywhere, that's the best place for it to happen. I already almost had a mental breakdown this morning. I'm just really nervous about going to my 4 o'clock class. It's a small class, which is good, but in the syllabus, the professor sounded kind of like stern and intimidating, and apparently like discussions are 20% of our grade, and I don't do well with discussions, and it's on controversial topics. I think right now I'm just gonna do my makeup, and I'll worry about getting dressed a little bit later. I'm feeling a little bit unmotivated, and I'm also feeling kind of stressed out. I feel like if both of the exams were not in the same week, I would not be feeling this way. Even if they were a week apart, I would be feeling so much better because there is a lot of information that I need to know for both of these exams. And I want to do good on the first exams. It'll set my grade up to a point where I at least have wiggle room. If I, for whatever reason, bomb a different test, it's not going to bring my grade down terribly. It's better to start high than start low. It's harder to get yourself back up, you know? So I'm feeling really stressed, and I think it's because of how I'm studying right now. I don't usually study this way, but I figured right now it would work the best for... I've done this exact method before. I just don't always do it. It really just depends on how I'm feeling. And honestly, for these 2 units, at least for the first exam, I feel like this is the best option for me. It's just taking a lot of time because I'm working with material for 2 different classes at the same time, so it's just taking a lot longer and a lot more out of me. And as I'm saying that, I don't really feel like I should be complaining about it because I knew that this is what nursing school was going to be like, and I did have it easy last semester because I only had to worry about fundamentals. But now that I'm adding on pharmacology to my normal nursing rotation, it's just a lot. But let me just explain kind of what I'm doing and how I've started to take notes and what my study plan is kind of going to be. So I've just been using this little notebook and I've just been taking notes off the slides. And with PathoPharm as well, I got this notebook on Amazon. Sorry that it's backwards. It's just a nursing pharmacology notebook. If you search it up, I'm sure you can find it. They have other colors and patterns as well. I just thought that this was the cutest one. I got one for med-surg as well. Inside, they have pre-made templates. So this one's obviously for medications. So the entire book is just medication templates. So it makes things a lot easier when it comes to learning about the meds. You can find it in one place. And I'm definitely gonna keep this for when it comes time to study for the NCLEX because this will actually be really helpful. But yeah, I have 7 pages in here filled out. I haven't filled anything out in the med-surg one yet just because we haven't really started talking about any diseases or any conditions. But yeah, that's kind of what my note-taking is looking like. But for studying, I think what I'm doing, I don't know if I'm gonna regret this, but I feel like it'll make things easier. I usually will take notes, and if I feel like, oh my God, why am I doing it this way? I just thought of something, and this might be a huge regret because it means that I'm gonna have to completely start over what I've been doing, but it's something that I'm used to doing, and I feel like if I do it this way, it might actually work better for me. I love the idea of keeping my notes in here, but I think it's the way that it's set up that seems a little bit overwhelming. If you guys watched one of my previous Week in the Life of a Nursing Student, so you probably saw my note sheets from last semester, and it was basically one piece of paper where I just fit all of the information on. So one piece of paper was like a giant flashcard, and what I would do is I would go through, and as I realized that I knew certain things, I would just highlight it off, and it made studying feel a little bit more gratifying because you know how like if people have a task list and you're checking things off that you've already done, you kind of get like a dopamine rush of feeling like you've accomplished stuff. I kind of feel the same way about highlighting the things I already know because 1, I'm like, okay, wait, I know a lot, and 2, I can see how much I have left to learn before the exam. So I think that's what I'm gonna do. I had started making flashcards, but I can't learn from flashcards. It really depends on what it is, but not only that, it just takes a lot longer. So I do think I'm gonna go grab a piece of paper, multiple pieces of paper. It's gonna take me a lot longer than I think it will. But I think I'm just gonna take multiple pieces of paper and just kind of go through all of my notes once again and rewrite it in that kind of format just because it really does work a lot better for me. And it's a little bit more fun to do because it looks really pretty. I don't think I'm going to add any of the medications on the pharmacology sheet just because they're already in here. And I feel like just looking at them this way is so much easier. It'll also save me a lot more time having to rewrite all of this stuff. Okay, I just wanted to do a quick update because I finished my note sheets or study guides for each exam. My fingers hurt, my wrist hurts, my elbow hurts because I've been writing nonstop for 6 hours. I wish I was kidding. But I just wanted to quickly show what they look like, because this is what I will be studying off of for the next few days to a week. So for med-surg, I ended up doing 2 pages. And for pathopharm, I did 3 sheets. And that's not including the medications that are in that other notebook. So there's a lot. So as you guys know, tonight is the night before clinicals. It is currently almost 10 o'clock at night, and I want to get to bed within the next hour and a half, because I think I'm gonna get up at 4 in the morning, which I know sounds crazy, but I want to be ready. I want to slick back my hair, you know, just all the fun stuff. Good morning, guys. Happy clinical day. I feel like I'm gonna throw up. So I know that I didn't record much of anything today, and that's obviously because I had clinicals. I did get out very early. It's just before 4 o'clock. I got out 3 hours early, but it was also orientation day, so it makes sense. There also wasn't a ton for us to do because I'll basically just quickly recap the entire day, but I'm not going to go into detail. The first 3 hours was just my instructor throwing information at us about how to use the charting system and just everything, how everything in the hospital works. And then she had some of us go off and play around on the charts while she would take 2 of us at a time to go do patient care, because even though she knew that all of us in the group were already LNAs, she wanted to see us do care before she let us just go on our own, which was completely fine. I saw a lot of really cool things today. I did see a attempted catheter insertion. It didn't happen though because the patient had a blockage. It was actually a blood clot, and after 3 or 4 attempts of trying to get the catheter in, it wouldn't go in. Although I've seen catheters inserted before, I've never seen them actually get inserted, if that makes sense. I've seen people with catheters, but I've never seen them be put in, so that was kind of interesting to see. And obviously I've done it in lab, but I've never seen it in real life. We did see a PICC line for the first time, which was really interesting. But yeah, it was a pretty chill day. I love my instructor. She's literally the nicest ever. She explains things so thoroughly, so well, and she expects highly of us because she knows that we can do it, and that's just very important, and I love that. And I also love my placement. I love the hospital. It's a fairly small unit, so it's really easy to get around, and I absolutely love it. Okay. I did not record anything today, and that's because I've been in the worst mood all day. And I just had a mental breakdown, first one of the semester. Keep in mind I've been in school for a week as of today. I'm already having a mental breakdown. So I just kind of want to explain my thoughts because I know that I'm not the only one that feels this way, and I know I'm not the only one that's ever felt this way. And if you're about to go into nursing school or you're currently in it right now, just to know that this is completely normal and it's okay to have a mental breakdown and you're not alone. It's really tough and it's impossible not to feel the way that I'm feeling right now. So all day Tuesday, I was just spending the day stressing out so bad about clinicals on Wednesday. You know, I mean, it was the first day of clinicals for the whole semester, my first time in a hospital setting, new instructor, new clinical group. Obviously that's a lot of stuff that can cause some anxiety. All day Tuesday, and I would say the first 2-3 hours of clinical, my body was completely in fight or flight mode. And when your body is in fight or flight mode, your body kind of wakes up. It gives you a sense of adrenaline, so you're very awake. I had a very hard time sleeping Tuesday night. I ended up only getting 4 hours of sleep and then went to clinicals. We did get out early, but I was still there for about 9 hours. After the fight or flight mode had relaxed when I was at clinicals, I was still getting a lot of information thrown at me, whether it be about how things are done at the hospital, certain policies, procedures, stuff like that, or just like a bunch of information about how certain skills are to be done, new skills that I've never heard of before. She was explaining, talking about like stuff that she is going to be teaching us this semester. She was basically just explaining them before she shows us. And then she was talking a lot about the patients we were seeing and their cases and stuff like that. So it was just a lot of information being thrown at us. And we also did do some skills and some patient care, so obviously that can be exhausting. And when I got home last night, I was starving, so I needed to eat. I was able to relax a little bit, but I had to go to bed, wasn't able to sleep again. So I went to bed kind of late, had to get up early today and sit through 4 hours of lecture. And then now all I want to do right now is take a nap, because that's the other thing, is that once your body is out of fight or flight, you become exhausted, like genuinely physically and emotionally exhausted. For example, last semester when I finished my lab practicum, which is basically like the final for your skills lab or your sim lab, whichever, I was in a state of fight or flight for about a week straight up until the day. And after I had done my final and passed it, I literally got home and took a 6-hour nap, like accidentally. Like I literally just crashed and didn't wake up until like 6 hours later, which is not like me. Like I don't take naps, but like I feel like I need a nap right now. But unfortunately, I know myself, and I'm the kind of person that if I take a nap, I wake up with an excruciating headache, and I wake up exhausted and grumpy unless I sleep for a really long time. That's the problem, and I don't have time to sleep for a long time because I need to study, and that's causing more of a mental breakdown right now because I'm just really frustrated and exhausted because I feel like I can't even relax right now because I have to study. I have an exam on Monday. It's Thursday night right now, and I have to study for an exam on Monday, and then somehow have to fit in some time this weekend to start studying for my exam that's on Thursday, because I'm not going to have time on Tuesday or Wednesday to study for it. So it's really exhausting. At this point, I'm just like very drained. I wish I would have recorded more today, but I needed a mental break from it. You know when you get so tired, you just want to cry? That's how I've been feeling all day, and I finally just let myself cry, because when I was trying to sit through my 4 hours of lecture this morning, I literally just was like holding back tears the whole time because I'm just so exhausted. I don't think people who aren't in nursing school understand, like genuinely understand, how draining and exhausting it is to constantly have homework to do, constantly have studying to do, constantly have paperwork to fill out for clinicals and lab, constantly having pre-lecture assignments to do, constantly having to study for something, then having to wake up early to go to clinicals for 12 hours and be put through loads of stress and anxiety. I don't think people genuinely understand how exhausting it is. Not only that, but I'm also commuting, so I drive almost an hour back and forth to school every day, so that's also very exhausting and draining. I have tomorrow, Friday, completely off, and I have Saturday and Sunday off, but like at the same time I need to find time to give myself a break, to pull myself away from school, because if I don't, I'm gonna get burnt out, and I don't want to get burnt out the second week of school, you know? But I also know if I give myself a break, I'm gonna feel really guilty about it because I know I should be studying. But I think right now I'm gonna grab my whiteboard and some markers and start studying, because what I do is I take those note sheets that I made the other day and I write out the topic and just rewrite stuff over and over again until I know it. I either do that or I'll talk myself through it, but right now I feel like I want to just go downstairs, hang out with my parents, and I obviously don't want to talk myself through certain things in front of them and stuff, so I'll use my whiteboard for now. And then when I come back up here later, then maybe I'll talk myself through stuff, but I want to try to get as much of it done as possible. But right now I'm just feeling very drained and stressed out, and I can't think of any other words to use for it other than that. Just straight exhaustion and not being able to let myself rest right now. Good morning. It's Friday, and as you guys know, I don't have any classes, but I am going to take today to study a little bit, and I'm also going to go see my boyfriend because I do need to pull myself away from schoolwork. Right now though, I'm just trying to figure out what I want to wear. I was going to wear this, which is just the same exact quarter zip I had on last night, and then these pink fig scrub pants. They're so comfy and they're actually like really cute, but I kind of don't want to wear this anymore. So here's the outfit. Nothing crazy. I just wanted to be kind of comfy today. So I just wanted to give kind of an update on how studying has gone and how it went last night. It actually went really well, and I was actually really surprised at how much I actually got done. So I'm feeling a little bit less stressed out right now. Not only that, but I also just want to say, because I'm sure you guys have seen it this entire video, yes, I still have my Christmas tree up. I have not had time to take it down yet. So as you guys know, I did do the note sheets. I was able to learn an entire note sheet last night. An entire one. Plus a little bit more. That's crazy. This is stuff that I have to know Monday. And the really cool thing is that a lot of the other stuff that's on this page, I don't have to know all of it. So like, for example, these 4 things at the top is basically just talking about different types of anesthesia. And my professor said yesterday that we actually don't need to know that for the exam. It's just for us to see and understand and know. Okay, so I'm on the way to my boyfriend's house now. Sorry if you hear a lot of slushing sounds. The roads are not great and my tires are catching the salt on the roads, so there's a lot of noises happening. I did review everything that I had studied yesterday and I still know it, so that's good. And I was able to memorize 2 of the medications, but I still have 6 more to go. So that's a lie. I still have 7 more to go because we have 9 that we have to know. I know I'm back in the car again. I'm sorry about it, but it is Saturday now, and that does mean that the week has technically come to an end as far as me recording goes. So I am gonna stop the video here. I feel like this week had a lot of ups and downs, but overall it was a pretty great week. I am gonna end the video here. I hope you guys enjoyed. Thank you so much for watching. And if you're in nursing school right now, I wish you all the best of luck. And I hope you also had an amazing week. I will see you guys next week, and we will be able to see together how I did on both of my exams. Bye!